Hello friends, welcome to the online Repertory Training Course 2022. This is a part of lecture series from the Journey with Dr. Ghanshyam Kalatia. This is the most popular course worldwide. We have participants who are at different levels of practice. Some are college students, some freshers, some in the mid-years of their practice, and some are very senior practitioners. But this course remains an interest with all of us. I'm Dr. Naaz Kazi, practicing classical homeopathy for past 23 years. I feel immensely honored to be a mentor to this course, and I'm very grateful to sir for giving me this opportunity. I will be sharing the introduction to repertory and its practical application. So friends, let us try to refresh our knowledge. But before I start the presentation, I would like to share this quote about repertory by Dr. John Henry Clark. He quotes, "It is impossible to practice homeopathy as it should be practiced without the aid of repertory." So let us see the introduction of repertory. What is a repertory? The word repertory comes from the Latin word repertus, which means to find. In our times now, it basically works like an internet search engine. So repertory is an index of symptoms which are arranged in an organized pattern under different chapters, and they list different remedies for it. These are known as the rubrics. The repertory can be in the form of a book, a card, a CD, or a software. Now, what was the need for a repertory? Let us see. During Hahnemann's era, only few remedies were proved, and it was possible to memorize the symptoms of these few remedies. But as the provings increased further, it was no longer possible to remember all the symptoms. Hence, symptoms had to be put in an index form, and this gave rise to the homeopathic repertory. Hahnemann himself made the first repertory, which he called as Fragmenta de Viribus Medicamentorum Positivis. Later, Bonninghausen's with Hahnemann's concurrence made the repertory of antisorics, and further different types of repertories were developed. More than 125 repertories were made. Many were complete repertories and some focused only on a specific area. What were the different types of repertories? It was either the book form, the card form, or mechanically aided. Let us further see on this. In the book form, we had the general repertories and the particular repertories. In the general repertories, we had the Puritan group and the logico-utilitarian group. Puritan group is the one where the language of drug proving is maintained in its purity. For example, the Nair's repertory and the Gentry's repertory. In the logico-utilitarian group, the symptoms are arranged to fit the design of the repertory for its best utility, but these do not maintain the language of the proving. In this group, it was further divided to the Kentian concept, for example, the Kent's repertory, the Bonninghausen's concept, example, the therapeutic pocketbook, alphabetical repertory, which is the Fartek's repertory, the general clinical, for example, Clark's repertory. In the particular repertories, we had regional repertories and the special repertories. The regional ones, for example, could be Morgan's urinary organs. The special repertory, an example could be Bell's diarrhea. Then we had the card repertories. There were many card repertories. For example, the Kishore's card repertory, the Boger's card repertory, Dr. P. Shankaran's card repertory. Then came the mechanically aided, and we had the softwares like Kara, Radar, Mac repertory. We have the HomePath, and now we have the Synergy homeopathic software. Let us now see the uses of the repertory. It helps us to memorize the remedies. It acts like a bridge between the materia medica and the patient. By converting the patient's language to the repertorial language, we can find a simillimum for the patient. Over the time, what happens is we only know a remedy by a few of its characteristic symptoms. But by the frequent use of a repertory, we get to know the other symptoms of the remedy, and hence we can learn the whole picture of this remedy. We can know the peculiar symptoms of remedies. We use the repertory to differentiate one remedy from the other. With the help of software repertories, we can study the various families and the common sensations in a given group of remedies or a given miasm. What are the disadvantages of a repertory? It can be misused by mechanical repertorization. Well-proved remedies are highly represented in the repertory. The nosodes and the sarcodes are not represented well. It cannot be solely used because it has to have a materia medica as a reference. Now, let us see the application of repertory. In order that we help our patient and get the closest similarium for them, it is important that we know our tools well. Our tools are a detailed case taking and the repertory. To use a repertory well, we need to know its structure, its content, the arrangement of rubrics, and the concept for the formation of this repertory, so that we will be able to locate our rubrics well, and also we'll be able to ask proper questions to the patient to select the peculiar symptoms. Let's see the conversion of symptoms to rubrics, because this is how we apply the repertory. The conversions of symptoms of patient to the repertorial language. We will do this with a few examples, and the repertory that we will use will be the Kent's repertory. I suggest that we all do a rubric hunting every day with 10 rubrics. It is really a fun activity, and this course is full of such activity. Let us convert the symptoms of the patient to the repertorial language, that is the rubrics. Let's take this example. A female patient, 24-year-old, complains she cannot sleep since a week after the death of a dog. Let's see what we find for her. Sleep, sleeplessness, grief from. Then her heart beats fast and she cannot sleep. Sleep, sleeplessness, palpitation from. Also, we need to look at the similar looking rubrics like in the cross references. So we find chest, palpitation, heart, sleep ongoing too. She keeps thinking of her dead dog all day long. Mind, thoughts persistent. Her head is paining since the incident. So head pain, general, grief from. Let us put all these rubrics into the repertory and see. So after putting all the rubrics into the repertory, we get this repertorial chart, and the remedy that comes up is Natremure. Let us take another example. A female patient, 45-year-old, complains of itching all over the body, mostly at night. It comes off and on since 3 years, and the dermatologist diagnosed it as urticaria. So let's see what we see. Skin eruptions, urticaria, night. There is redness and burning. So skin discoloration, red. Skin burning. She has to take a bath to relieve her itching. So generalities, bathing ameliorates. She gets the itching whenever she is angry with her children. So mind, anger, ailments after anger. We put all these rubrics into the repertory, and this is the repertorial totality, and we get the remedy as APIS. We've seen how we could convert the patient's language to the repertorial language. But now we should also see how we can apply the repertory practically in our clinical practice. So for this, I have taken some paragraphs from Dr. Kent's repertory. Let's see them. On how to use the repertory. He says, as homeopathy includes both science and art, repertory study must consist of science and art. The scientific method is the mechanical method. taking all the symptoms and writing out all the associated remedies with gradings, making a summary with grades marked at the end. Then he says there is an artistic method that omits the mechanical and is better, but all are not prepared to use it. The artistic method demands that judgment be passed on all the symptoms after the case is most carefully taken. The symptoms must be judged as to their value as characteristic in relation to the patient. They must be passed in review by the rational mind to determine those which are strange, rare, and peculiar. Here, Dr. Kent means to say that the artistic method of repertorization is better than the mechanical method of repertorization, and hence we should give importance to the artistic method of repertorization and look for the peculiar, rare, strange, and characteristic symptoms in a case. In my clinical practice, I have few cases which I have taken as examples to emphasize this, and let me share them with you. So case 1. This is a case of a boy, 18-year-old, with cystic acne on both cheeks. He visited me in 2014. Brief case history. This boy is a sales boy and he works in a shop which is just next to my clinic. He sells bread and biscuits over there. And one day he comes to the clinic and he shows his face full of pimples, and he says that I am very much troubled with these pimples and they are there since past 2 years. And when one pimple comes, it's very painful and it itches a lot. And he says that I do not stay with my family since they live in the native land and I stay alone here. So I have to eat food, outside food, which is very oily and mostly fried. And I cannot eat because the pimples increase more. And he likes mutton, but again he cannot eat the mutton because that also increases the pimple. And his job of this selling bread and biscuits demands him of traveling in the morning hours on the bicycle and selling it door to door. So he says that is the most troublesome time for me, because when I come back, my face becomes full red and the pimples have increased in size and number because it's very sunny that time. And this is what he could give of his symptoms. So I try and ask him more of the local symptoms for the pimples, whether there is any kind of a discharge or if they bleed on touch or anything that could really be characteristic to that local modality. But he said, no, doctor, this is what I can share with you, and please just help me out with this, because this is a day-to-day trouble to me as I cannot travel in the sun out, and they become more in the, I get a lot of trouble in the sun. So I tried to ask him furthermore of him as a person, because I had to find something which is characteristic to the case. So, but for him that was not important because for him it was just these pimples. And but I still keep on asking more about it, tell me more, and just have a casual kind of conversation with him of how are his day-to-day activities and where he lives, what happens. So I come across this symptom which he shares, and he says that, doctor, whenever my pimples are better, like I don't have them or they're less, my stomach gets upset. I get loose motions. And for me, this was something which was peculiar kind of a symptom, and it was characteristic to the case. So I try and look into the repertory to see if I have this, and we have it as face eruptions acne alternating with digestive complaints. Only one remedy given in the complete repertory, and that is graphites. Now, my work was easy and I had to just see if the other symptoms of the case also are covered by graphites. So I try and take the other symptoms where I put in as face eruptions acne alternating with digestive complaints, generalities, food and drinks, meat desires, generalities, food and drinks, meat aggravates, generalities, food and drinks, fat and rich food aggravates, generalities, sun aggravates. In the repertory totality, I see that all these symptoms are also covered by graphites, and my prescription was graphites 200, 2 doses, that is 4 pills once a day for 2 days. And I give him SL 4 pills twice a day for 1 month. And I ask him to come and show me after 1 month. I have some pictures to share. So in the follow-up, when the patient comes after a month, he says that the skin complaints are better and the itching and the new eruption formation has stopped. So let's see the before and after images in a month's time. This is in July 2014 when he comes to me, and this is in August 2014 after giving 2 doses of graphites. So we see a considerable reduction in the size of the acne as well as the number of the acne, and almost there are no new eruptions on his face. Let's take the next case. This is an acute case of erysipelas in an elderly 90-year-old male patient, consulted on the phone in 2016. This case is also published in H-Pathy in last year, June 2021. So the brief case history. The patient's daughter sent me this picture on WhatsApp, and she narrated the symptoms on the phone. And she said that it looks so very red and so very scary that I need very quick help on this. So I asked for the symptoms and she says that it is just a skin rash which is red, and there is a lot of swelling and there is blister formation. So I asked what is happening to the patient, and she says there is no itching, no burning, no any pain, only this redness. And the patient does not even have fever, and he's not even complaining of anything. It's only the daughter who's scared by the look of the skin. So I try and ask her if there is any kind of a causative factor to it, whether if there was some insect bite or where he injured himself. And she says nothing. Probably he was just working in his home garden, and exposure to dust and dirt could be the causative factor. So this is what I had in the case. So, and I had to give a remedy very quick. I had to run my mind and think of something which will help him very quickly. And what is peculiar in this case? We had an inflammation which had redness, swelling, blister formation, but we had no itching, no burning, no pain whatsoever. So this was peculiar for me in the case. This kind of an anesthetic kind of an effect where there's so much of inflammation, but the patient has no pain, no burning and no itching. So I had to find if our repertory had this kind of a symptom, and it did. Skin numbness, insensibility. I put the few rubrics in the repertory: skin numbness, insensibility, skin redness, skin inflammation, skin erysipelas, generalities in old people. And after putting all these rubrics in the repertorial chart, we get the remedy: anacardium, lachesis, pulsatilla, sea kale. I had to further refer to materia medica. Bogus synoptic key in anacardium gives this symptom as skin insensible. Even in Fartak's repertory, in anacardium, I found the same symptom. Hence, my prescription: I gave the patient anacardium 30, 4 doses to be taken frequently. The follow-up, which was 8 to 10 hours after the remedy, the redness, the swelling, the blisters, they all started to reduce, and within 4 weeks, the lesion healed with very negligible scar. I have an image. I hope you can appreciate the before and after images, which is 4 weeks later. The first image which the daughter had sent us on the phone, and this is the image which she sent later after giving the remedy, and 4 weeks later it has almost healed with very negligible scar. So friends, this is all that I had to share. I thank all of you for listening to me.